on somewhere between Grey's Anatomy and Untold Stories of the ER. 3 doctors are given patients with severe circulatory conditions. But first, before you watch this episode, you must understand the circulatory system. First, oxygen is brought into the body and held in the lungs. The oxygen then moves through the bronchioles into the alveoli. In the alveoli, there are capillaries where oxygen enters the bloodstream and is sent to the heart through veins. The heart then pumps the blood by contractions and relaxations to all of the body parts using arteries. After this, the deoxygenated blood is sent back to the heart through the pulmonary artery. As you can see, the respiratory and circulatory systems are interrelated because if the lungs stop taking in oxygen, then the blood will not be oxygenated and organs will start shutting down. Thank you, and enjoy the show. Hi Emily, how do you feel?
I feel fine. I see the bleeding stopped.
Yes, we were able to clot the wound, but I'd like to talk to you about future treatments. Are you aware of why you have hemophilia?
Yeah, it's genetic. My mom has it too.
Yes, that's correct. It does come from your mother. To go further into what that means, you have to understand the components of your blood. So basically, there are 13 clotting factors that all work together to help stop bleeding when it occurs. If you don't have one of these components, one of these factors, or it's missing, as in your case, then you therefore can't stop the wound.
So basically, I'm missing parts of my blood and I can't heal cuts by myself?
Yes, that's correct. So what we did while we were in surgery is we infused some of the missing components into your blood to help with the wound.
Am I healed yet? Can I get cut without worrying?
Well, not exactly. The treatment we did today was temporary, but there are some options for the long run, called factor replacement therapy. It is a very expensive and long process, but it would combat your hemophilia forever. Or you can wait until it's necessary and continue with the temporary treatments like today.
Which one would benefit me more? Which one's easier?
Well, the long-term treatment is time-consuming, but once it's done, you won't have to worry about it. While the temporary one leaves you in the same condition as you are now. Personally, I would recommend the long-term treatment.
Okay, I'll do it.
Hemophilia is a very serious condition. It affects 1 in 25 million females and 1 in every 7,500 males. If you are a parent looking to have children, please get tested to make sure you are not a carrier of hemophilia. Together, we can stop this deadly disease. Amber, I just wanted dinner. Let's go to the hospital.
Hi, Ember. How are you feeling? I'm okay. What happened? You had a heart attack. Your sister told me you have high cholesterol. Is that right? Yes. Well, that might be one of the leading factors as to why you had a heart attack. How so? Well, cholesterol is an organic molecule found in many foods that contain fat. Do you happen to eat a lot of red meat or fish? Yes, very often actually. You see, those 2 foods are very high in cholesterol. And if the cholesterol starts to build up in your bloodstream, it could block the coronary artery. The plaque builds up and it could eventually rupture, causing blood clots. And if they're big enough, it could stop blood flow completely. What happens then? Well, when the artery is blocked, blood can't easily pass through, and a section of your heart can't get any oxygen-rich blood. That is a heart attack. How come I didn't know about this? Well, have you ever been to a heart exam due to your high cholesterol? Yes, but they didn't tell me much. Well, I found that you do have coronary heart disease. All of what I explained to you is what this disease is. Plaque builds up and your coronary artery clots due to the rupture of the plaque, leading to poor blood flow to the heart. Well, how did you fix it? It seems complicated and dangerous. Actually, it was quite an easy procedure. All I had to do was take a very small, thin, flexible tube with a balloon-like mechanism on the end and insert it into your thigh. Here, the tube is now in your blood vessel, and I find the spot where it is clotting. When I have located the clot, I inflate the balloon, and the buildup of plaque gets pushed to the walls of the vessel, allowing the blood flow easily to the heart again. This procedure was non-surgical and is called percutaneous coronary intervention. Thank you for doing it, but I still don't understand how I didn't see it coming. Are there any symptoms? Actually, there are. You may have experienced discomfort in your chest, indigestion, sweating, nausea, extreme weakness, or irregular heartbeats. Did you notice any of these? Now that I think about it, I was weak and tired. Also, my chest always hurts, and I got this heartburn type feeling. I guess maybe I should have known. But now a really important question. How do I prevent this from happening again? I would say take aspirin. It will thin the blood and reduce the risk of having it clot. Or you could take something like FEN, which prevents blood clots. However, the most important thing to do is to maintain a healthy diet. Try eating foods with less cholesterol. For example, foods with high fiber. If you do these things, you should be good to go. Will do. Thanks again.
Coronary heart disease is the most common type of heart disease, killing 380,000 people annually. FEN can stop blood clotting of the coronary artery and save a life today. A side effect of FEN is easy bleeding due to the unclotting of the coronary artery. Buy it today!
Ow! How long was I on the couch for? My legs are killing me. And they're swollen too. I need to walk around more. Ow! My legs are swollen, cramping, and tingly. I have to go to the doctor's.
Hi, Diana. I hear you're having some problems with your legs. Can you tell me your symptoms and can I take a look?
Sure. So about 5 days ago, I was on the couch, and when I tried to stand up, my legs were swollen and cramping. I thought it was just because I was sitting on the couch for a while, but then it just got worse, and now they're really, really swollen and cramping, so I figured I'd come here.
Okay, well I can see that you have some varicose veins. Can you tell me when those showed up?
About a week or 2 ago. I didn't think anything of it because my mom started to get them when she was my age.
Alright, so what I want to do is an ultrasound on your legs. It's called a vascular ultrasound so that I can see your veins so we can figure out the problem, okay?
Okay.
So, it appears as though you have chronic venous insufficiency. This means that a few veins in your legs aren't pumping blood properly back to your heart. The blood is building up in these veins and causing the swelling, tingling, and cramping.
Okay. Are there any treatment options?
Yes, there are many treatment options such as just wearing compression socks, except yours is so severe that I'm suggesting that we do sclerotherapy. This is where we inject saline into your problematic veins, and this will harden the veins and they will eventually disappear.
Okay, let's do it.
Hi, and thank you for watching our show. Now I bet all of you thought that the only purpose of this episode was to teach you about the circulatory system. What you didn't realize is that we were also testing your observatory skills. Did you notice that in every scene there were silver pants somewhere in the background? If not, let's take a look at all the hidden places.